In the dramatic world of Canadian decision-making, there's a ticking clock on a contentious issue: euthanasia expansion. This high-stakes debate revolves around the emotional stories of individuals facing insurmountable suffering. They argue passionately for the right to end their own lives, seeking help when all else fails. Yet crafting a moral and consistent framework to govern when, where, and how doctors may assist in ending lives, rather than saving them, proves to be an intricate challenge. In this moral drama, well-intentioned individuals grapple with the complexities of compassion.
Recent years have witnessed a select few countries authorizing medically assisted death, ranging from lethal injections to physician-prescribed medications for self-administration. In the United States, physician-assisted suicide is lawful in 10 states and D.C., a concept we have cautiously supported. However, the storyline in Canada takes a riskier turn. Canada already boasts one of the world's most lenient euthanasia systems, granting patients the power to request medical assistance in dying, MAID, a practitioner-administered lethal injection, for physical conditions they find unbearable, regardless of terminal status. If no last-minute policy change occurs, Canada will go a step further on March 17th by permitting MAID for patients whose sole ailment is a psychiatric one, such as depression or schizophrenia.
In this moral drama, well-intentioned individuals grapple with the complexities of compassion. Proponents of this expansion frame it as a victory for patient autonomy and equality for the mentally ill. However, this narrative could potentially jeopardize the lives of vulnerable individuals, who, by definition, might struggle to grasp reality, with symptoms that even experts find challenging to specify. While there may indeed be mentally ill patients enduring debilitating and intractable symptoms, distinguishing them reliably from others in mental distress who could benefit from treatment remains an exceedingly difficult task, if not an impossible one.
Canada's existing system is ill-equipped for this challenging narrative arc. Its MAID regulations are more relaxed than those of Belgium and the Netherlands, where psychiatric euthanasia has been legal since 2002, but has raised serious concerns. Since Canada's legalization of euthanasia in 2016, a staggering 44,958 Canadians have received permission for MAID due to terminal or grievous and irremediable medical conditions. The majority of these cases have occurred in the past 3 years, with an annual increase of over 30%. In 2022, only 3.5% of euthanasia requests were rejected, highlighting rampant non-compliance in some provinces, such as Quebec. Patients can freely shop for a willing provider if their request is denied.
Mental suffering, as portrayed in this gripping narrative, can be as real and unbearable as physical pain. However, enabling a mentally ill person to seek a physician's assistance in ending their own life goes against the core principles of psychiatry, which primarily aim to prevent suicide rather than facilitate it. Many individuals in the depths of psychiatric distress may temporarily see suicide as their only escape, only to later be grateful they did not act upon it.
The American Psychiatric Association firmly states that psychiatrists should not provide interventions to non-terminally ill individuals with the intention of causing death. 2 other English-speaking countries that permit assisted death, Australia and New Zealand, exclude purely psychiatric cases. Many Canadian mental health professionals argue that offering MAID to those with psychiatric illnesses is unwise, particularly in a country struggling to provide adequate mental health treatment to all who need it. The Canadian Association for Suicide Prevention opposes this storyline.
Last month, Canadian Justice Minister Arif Virani hinted at a potential delay in implementing this controversial expansion, pending a parliamentary commission report due on January 31st. This moment of reconsideration, though belated, offers a glimmer of hope.
Advocates for the expansion may believe they are championing individual freedom and equality for those with mental illnesses. However, they must remember that no procedural protections are flawless, and creating them for psychiatric euthanasia presents an immense challenge. In this riveting narrative, good intentions often lead to unintended consequences. Across the border, Americans should watch closely and learn from their neighbors' experience in this morally charged story.
We examined the Washington Post's editorial board opinion piece, and here are some of the responses.
Kiri Kat from Canada had this to say: "Leave us alone. When you stop putting people to death, capital punishment, And when you stop trying to control women's bodies, anti-abortion, then, and only then, can you take a superior tone about granting people the right to end their own lives.
This, from an individual that calls himself Illegal One. Quote, "Until the Canute want America firefighters are health care. And of course you joined NATO without the military requirements and expect once again for the USA to protect you."
Richard Pearson chimed in, "Canada's firefighters have helped US states on multiple occasions. Canadians using US healthcare services a myth. Our system is excellent. And Canada is a founding member of NATO who responded to USA's call for collective action when they activated Article 5 of the NATO treaty."
And Lester Ross 1 added, quote, "What a load. Canadian power workers, firefighters, and all manner of rescue crews go to disasters in the States whenever needed. We send troops and weapons to NATO allies, etc. Do a little digging for info and get off your high horse. Watch Come From Away to see how your fellow citizens were welcomed and treated like family during the air closure on 9/11.
Edward Hackett had this to say, "It seems that most of the people against assisted suicide have a religious reason, or they have good health care and plenty of money, so their lingering doesn't financially cripple their surviving relatives. No one talks about the pain suffered by surviving relatives as they watch someone they love slowly die and usually in great pain. I'm 81 years old and in good health. I strongly feel that the decision should remain with the patient. It angers me the way our Congress people, who have the best health care and pensions, are always trying to cut medical benefits to those who can least afford health care. I don't even want to start talking about the terrible state of health care for those in need of mental health care. Until the fat cats in Congress show some sympathy for those much less fortunate than themselves, I will continue to view the subject as just one more example of those with the power grinding away at those less fortunate."
Cankiss added, quote, "This week, I just watched my best friend of 46 years die slowly and painfully over 2 weeks, basically starving to death, after 2 years of chemo to fight abdominal cancer. Even with palliative care, which also withholds water and food, he was crying out in pain near the end. This didn't need to happen. In addition to the grief of losing my friend, I am angry.